Thank you, our cameraman and camera woman. Can you position yourself so that I can start the event? Thank you. Good afternoon. Good afternoon once again. My name is George Austin Vinay, and I'm a journalist from Pan-African Television, and this afternoon I'll be emceeing this particular event. I also happen to be the media coordinator to the coalition. This afternoon, we don't want to waste much time of yours. We want to quick start everything and then we can end. For our pressmen and women who are here, please, if you're ready, give us a signal, then we can kickstart. Please, let's do well to put our phones on silence. It's very important. So we can pay attention to why we are here. It's very important. As we do that, can we call upon Reverend Dr. Samuel Samoa Asante for the opening prayer? Let's do that.
Thank you. Can we bow our heads and share a word of prayer, please? Our Father, we are grateful to you for such a moment like this. We thank you for an opportunity to communicate the truth concerning these things unto our nation. We ask for your power and your presence to take control over everything. Lord, we know we are pursuing a just cause, and grant your children wisdom and articulation to present the truth to help them, those who have not come to understand these things, get it, that lives will be saved. We pray in the name of our Lord Jesus. Let your power rule over this land and let your peace prevail. In Jesus' name we have prayed. Amen. Thank you.
Thank you very much, Reverend Dr. Samuel Samoa Asante. We know that Joy News, Asempa FM, Hunto TVGH, and social media are taking live coverage of this particular event. So let's take note. Joy News, Asempa FM, and then Hunto TV and social media. Okay, so straightforward, I call upon Reverend Bright and Albright to give us the reason why we are here. Reverend, the podium.
Thank you. My name is Reverend Bryden Albright, the Director for the Coalition for Public Health and Justice, the President, the Vice President, leaders and members of the Coalition for Public Health and Justice, members of the Peace, Freedom and Justice Lovers, members of the diasporas, members of Advocate for Christ Ghana, concerned Ghanaian families, members of the Fourth Estate present, we specially welcome you all to our maiden press conference today. We are the Coalition for Public Health and Justice, and this coalition is made of medical doctors, scientists, lawyers, pastors, businessmen and women. And we have a definite purpose. Number one, to promote respect for health rights and justice for all persons in Ghana. Number two, to ensure strict adherence to sound public health regulations. Number 3, to propagate credible scientific information about COVID-19 and other public health matters. And our purpose here today is to address the illegal COVID-19 mandate rollout in Ghana. We are also filing a lawsuit against the various state institutions that have made the vaccine mandatory in their respective institutions. Thank you.
Thank you very much, Reverend. So now that we know the reason why we are here, we have a couple of presentations that we'll be receiving from our key personalities who have been invited to be part of us. And the first to do the first presentation is Dr. Timothy Ama, Efficacy Levels calling for. Okay, Doc. Senior, thank you. So, Doc is a medical doctor by profession. He's also a pastor that I know, and is a very good friend of many of us here. He has been one of the key members championing this particular course of us right from day one, and he'll be doing us a just honor to give a detailed information as to why we are saying illegal COVID-19 vaccine mandatory rollout in Ghana. Thank you very much.
Good afternoon to us all. Oh, I can't hear the response. Good afternoon. So, as I've been introduced, my name is Dr. Timothy Oblija Ama, and I'm the Vice President of the Coalition for Public Health and Justice, and I'm the leader of the Concerned Ghanaian Doctors. I know the media house have been looking for us. Today I'm here. Hallelujah. Thank you so much. And I'm here to actually give us a summary of petitions that we have sent to the President of the nation and his response to us and our response to his response. So that is the purpose of my standing here, and later to answer any questions which may be posed to me. Thank you so much. So on the 10th of January 2022, we petitioned to the President to rescind vaccine mandates in public and private institutions across the nation. Over the past 2 years, the world has been embroiled over a fight against the COVID-19 pandemic, employing many measures, protocols, and tactics. This pandemic seems to have fostered an appearance of global unity and sense of community in an attempt to win this battle. Being a novel virus, many of these measures, protocols, and tactics have been at best educated guesses at fighting a virus of which we are still learning. Vaccines have been touted as our most recent and best tool at winning this war. However, we disagree with the strategy of banking all our hopes on these vaccines and directly or indirectly coercing Ghanaians to go for inoculations against this novel coronavirus disease, which, as previously stated, we are still learning about. We, as concerned Ghanaian doctors, we petition to the President requesting all forms of vaccine mandates across the country and requiring proof of vaccination with COVID-19 vaccines be rescinded with immediate effect and a pause in the vaccine rollout. We as physicians pledge to consecrate our lives to the service of humanity, practicing our profession with conscience and dignity, with the health of our patients our first consideration. Indeed, we are to uphold the principle of primum non nocere, which means first do no harm. As Ghanaians also, we pledged ourselves to the service of Ghana to boldly defend the cause of freedom and of rights, to cherish fearless honesty, resisting oppressors' rule. We cannot in good conscience stand by and watch the lives of innocent Ghanaians be gambled away and their basic freedom and rights of health abused. Before the rollout of any vaccine program, there are three major concerns that must be addressed. Namely, the necessity, the efficacy, and the safety of the vaccine. Looking at the available data and research concerning this pandemic and these novel vaccines, it is clear, at least to us, that these vaccines are not necessary, neither are they effective nor safe. On the point on necessity, as of the 5th of January 2022, there had been 148,079 total cases of COVID-19, with 13,576 active cases, 1,313 deaths associated with COVID-19, 45 severe, and 8 in a critical state. These numbers amount to an infection fatality rate of 0.89%, with 0.39% of active cases being severe or critical cases. At first glance, these numbers do not seem to adequately portray this pandemic, with quite a number of Ghanaians who trust in the media seeing this disease to be a death sentence. It is worth noting that the majority of deaths are in previously unhealthy individuals with multiple serious comorbidities above 65 years in a country like ours with a life expectancy of 64 years. Also, case fatality rate is probably much lower if you consider the fact that most people are not testing, both symptomatic and asymptomatic, which underestimates the denominator and probably exaggerates the case fatality rate. Seriously ill people and those who eventually die will most likely seek medical care in hospital and be tested. So the likelihood of people dying from COVID-19 outside the hospital is probably low. Also, significant effort is not being made to differentiate those who die with COVID-19, that is, those who die from other causes but tested positive for COVID-19 shortly before their death, from those who die from COVID-19, that is, those for whom COVID-19 is the primary cause of death. Making that distinction will probably reduce the number of COVID-19 deaths, reducing the infection fatality rate even further. A seroprevalence study from a town in Japan shows more people in the community actually have antibodies to the COVID-19, 396 to 855-fold more than the confirmed cases with a PCR testing. Although the quantitative reverse transcription polymerase chain reaction, that is what we call RT-PCR, has been described as the gold standard for diagnosing COVID-19, there are several difficulties involving its use. Concerns have been expressed about incorrect sample collection and processing, the cycle threshold at which a positive result is valid, and the relevance of a positive RT-PCR test with respect to how infectious a person is. Some of these challenges may contribute to the disparities in the test results seen from laboratory to laboratory all over the country. Acquired immunity after recovery from infection, commonly referred to as natural immunity, has been largely ignored and even in some circles treated as conspiracy theory. For decades in the history of immunology, full recovery from viral infections, provided one has an intact immune system without any comorbidity affecting immunity, confers some form of immunity against the disease caused by those viruses, almost always better than any vaccine. That knowledge seems to have been thrown away with the COVID-19. This truth is supported by an Israel study published in September 2021, which showed that individuals who recovered from the COVID-19 said they were 13 times more protected than individuals who have been fully vaccinated with a Pfizer vaccine 14 days after the second dose. In addition to the above, many cheap, freely available medications have been shown in many studies by physicians all over the world to mitigate the effect of COVID-19. Almost all of these pre-existing medications, which have been shown promising in initial studies, have been demonized and in some cases ignored for no substantive reason. Hydroxychloroquine, ivermectin, azithromycin, and others have always been known to be relatively safe. Some of these medications have been used for decades and are considered some of the safest medication in the history of mankind. Yet, almost all of a sudden, where COVID-19 is concerned, they have suddenly become dangerous medications. If there is safe, affordable, freely available early treatment for COVID-19, vaccines are no longer a priority. It doesn't take a genius to recognize the financial benefits of pharmaceutical companies in demonizing potential early effective treatment. If these medications do work, that's wonderful in humans' race fight against COVID-19. However, they are practically placebos. If they don't work, why the suppression and demonizing of these early treatments then, if the concern is health? Considering all this, wouldn't it be prudent to pause and ask ourselves whether these novel vaccines are necessary in the first place, especially where the young and healthy are concerned? It should be noted that we are an expansive population, with majority of our citizens young and vibrant. Now we move on to the issue of efficacy. During the early days of the pandemic, the general sentiment was to hold on for a vaccine to come and save the day. We were told that these vaccines were our only way out of this pandemic, providing immunity against infection, preventing severe or critical disease, hospitalizations, and death. Over time, however, all this have been shown to be false assertions. These vaccines do not prevent infections or spread. Recent studies show that the vaccinated are becoming more relevant in the spread of COVID-19. Many studies show outbreaks within fully vaccinated populations. Other studies show vaccinated populations as sources for outbreaks. And these studies, you can find them published by Lancet and other major institutions that is recognized worldwide. So this is not Dr. Tim saying something. This is something which is globally recognized. Over the last few months of 2021, the assertion that these COVID vaccines reduce the risk of hospitalization and death has been shown to be inaccurate as well. There are examples of this in other parts of the world. In the state of Vermont, USA, it has been shown that 79% of deaths in September 2021 were among fully vaccinated individuals. Over the month of September last year in the UK, approximately 79% of COVID deaths were among fully vaccinated individuals as well. And recent studies coming from Scotland, hospitals in Scotland, is showing that the rate of hospitalization of these fully vaccinated individuals is alarming, and the records are there. There are even schools of thought that theorize that the vaccinated are the main drivers of the pandemic. Are these vaccines really preventing transmission and spread? Many of the highly vaccinated countries are experiencing rising cases. In fact, 4 of the 5 most vaccinated countries are experiencing COVID-19 surges. Other studies also show that vaccination levels are unrelated, and I'm repeating it, are unrelated to COVID-19 rates. In other words, higher vaccination rates do not equal less cases and less death. Higher vaccination rates do not equal less cases and less death. And there are studies which have been done, which is confirming what I'm saying. Safety. Many safety issues have been raised all over the world with these new vaccines, most of which were developed under a year. With no reliable Ghanaian database of adverse events to COVID-19 vaccines, we had no option than to refer to foreign databases, namely the United States and WHO's databases. Individually as physicians, we have also personally seen many patients who develop known side effects of these vaccines within days to weeks of going for these jabs. Some of these include facial paralysis from Bell's palsy, infarctive strokes, thrombotic phenomenon, which we popularly call blood clots, pericarditis, myocarditis, visual disturbances, among others. However, from the database of the United States VAERS, he said there have been 20,622 deaths associated with COVID-19 vaccine as of 17 December 2021. The most recent available update, as at the writing of the letter we sent to the president, it showed a total of 1,017,001 reports of adverse events from all age groups following COVID-19 vaccines, including 21,382 deaths and 166,606 serious injuries between December 14, 2020 and December 31, 2021. The American verse has been shown to capture only about 1% of all adverse events. WHO's VGSS reports 2,873,250 adverse reactions to COVID-19 vaccines as of 31st December 2021. The WHO VGSS shows that adverse drug reactions reported in connection to COVID-19 vaccines are about double all other adverse drug reactions of other drugs and vaccines combined, though these other drugs and vaccine predates COVID-19 vaccines by decades. So the meaning of the word VAS, you heard me saying VAS. VAS simply means vaccination, adverse events reporting system. Okay, so this is the reporting system they have in the United States. There have been reports of pericarditis, myocarditis, and other cardiac issues, especially among young men who have taken the vaccines. Although some may suggest that these adverse events are rare, they are still significant enough to the point where these vaccines cannot be in good conscience declared to be safe. Vaccine adverse reactions have also been over the years been shown to be grossly underreported. How feasible is a vaccination rollout plan, and what are the implications considering all the information presented above? As previously stated, recent studies cited above show that vaccination levels are not related to COVID-19 case numbers. In other words, higher vaccination rates do not equal less cases and less death. Countries like Israel and UK are typical examples of this. These countries have very high vaccination rates, currently deploying booster programs, yet they are struggling to get the virus under control, especially with these new variants. If we as a country are to vaccinate more than 50% of our population, are we going to continue with perpetual boosters every 3 to 6 months in an attempt to maintain vaccine-induced immunity for this disease? Where then is the end point when these vaccines do not stop infection or the spread of COVID-19? Is this financially feasible for us as a nation? Again, as previously stated, contrary to the mainstream belief, some experts believe that vaccinated individuals may be the ones responsible for the emergence of this new, more infectious variant rather than the unvaccinated. A vaccine that generates antibodies against the original strain but does not prevent infection and spread selects for variants by allowing mutants which are not affected by vaccine generated antibodies to spread and become dominant. Viruses mutate, and we are going to continue to have mutants, especially with these vaccines that are relatively ineffective at stopping spread of the virus. Perpetual vaccination with boosters is simply not a feasible strategy. Our recommendations: Ghana and Africa at large should be expected to lead the whole world in the fight against COVID-19. Why do we say this? All the relevant metrics show that Ghana and Africa at large have done better than most of the world with respect to the pandemic, even before the advent of these vaccines. It is possible the rest of the world are rather to learn from us. We may well be on our way to herd immunity if we are not there already. Per our cultural practices, it is not practical to expect Ghanaians to do away with social physical contact. Many Ghanaians have probably recovered from mild or asymptomatic disease and developed acquired immunity. A seroprevalence study in a lorry station in Accra, yet to be published, showed about 70% of the samples collected had antibodies to COVID-19, probably after recovery from the virus. Per the dietary advice that the president gave the whole nation during the early days of the pandemic, many Ghanaians may have strengthened their immune systems after eating more of our local dishes and fruits, which tend to be high in vitamins, minerals, and other micronutrients. Further research into locally made remedies and treatments for COVID-19 should at least be considered. The treatment guidelines that the Ghana Health Service put together for the treatment of COVID-19 seem to have really been effective, enabling most of the peripheral hospitals to treat COVID-19 positive cases, except those that may need ICU care. Other cheap and safe treatment options like ivermectin, fluvoxamine, and adjuncts like thiamine, methylprednisolone, etc. should also be looked into. So after presenting this petition to the president, he wrote back to us, and we want the honorable Ghanaians to also hear what our president wrote to we, the concerned Ghanaian doctors. So the office of the president, via the presidential advisor on health, responded to our initial petition on the 18th January 2022, outlining the following points. The president said there is no and I'm repeating, there is no current official mandate requiring mandatory vaccine rollouts within the country. 2, he said, on the issue of necessity, there is clear evidence of public health impact of vaccination in terms of infections, hospitalizations, deaths prevented, and improved health outcomes that cannot simply be brushed aside, providing data from a single management center, which is the Ghana Infectious Disease Center. 3, the president said on the issue of efficacy and safety, Ghana continues to boast of a robust and advanced monitoring process in ensuring safety in our medicines, vaccines, and other health products, also stating that the most commonly reported adverse events following immunization are headaches, fever, pain at the injection sites, and body pains, which usually resolves within a day or 2. So receiving this response, we couldn't just keep silent about it. So we also wrote back to him. We acknowledged his response and we responded to his response. And I would brief the media on what he said to us. In acknowledging this response from the office of the president, we also took notice of a few things in the response and documented them in a written note back to the office of the president via the presidential advisor on health. 1, though it was stated that there is no official COVID-19 vaccine mandate, various government and private institutions have issued mandates to their employees and other stakeholders. Institutions like the Ghana Health Service, Ministry of Health, University of Ghana School of Medicine and Dentistry, Electricity Company of Ghana, Ghana Immigration Service, just to mention a few, have made it mandatory to show proof of vaccination before one can access their premises. 2, we also noticed that though statistics presented to us were meant to show that vaccines were effective at preventing severe disease, hospitalizations, and death, they rather show the opposite if you consider the context in which the data was obtained. For example, they stated that from 4th July 2021 to 14th January 2022, and the data was collected from the Ghana Infectious Disease Center. They said 10.1% of severe or critical cases were fully and partially vaccinated, and 89.9% were unvaccinated. What they failed to consider was that over most of that period, at least up to 4 December 2021, only 2.6% of the population were fully vaccinated and 5.7% partially vaccinated, leaving 91.7% unvaccinated. Obviously, most of the cases would be unvaccinated, since the vast majority of the population was not vaccinated at the time of the data collection. The data that was provided did nothing to show any efficacy whatsoever of the vaccines. If anything, it hurt the case for the efficacy of these vaccines for preventing severe disease and death. Point number 3. The response to our initial petition did not address our concerns with safety issue and adverse events following immunization with the COVID-19 vaccines, as noted not only from our personal interaction with patients and others who have encountered life-altering and potentially fatal adverse events, but also from very reliable foreign and international databases. The response rather was to praise Ghana's advanced monitoring system and only acknowledging mild adverse events. No matter what Ghana's FDA database may say, we, as doctors, we are seeing real people experiencing real adverse events consistent with those stated in said foreign and international bases, referring to the US virus as well as the WHO's VG-Access. Point number 4, the low case fatality rates, the strong immunity of the young and healthy, and the acquired immunity from natural infection also seems to be dismissed and not addressed in our response, or in their response. Point number 5, though it was not challenged in the response, our statement of the fact that none of the COVID-19 vaccines effectively prevent infection or spread, it was totally ignored and seems not to be considered in by some of these institutions in their vaccine passport system and mandates. Vaccinated individuals are just as likely to spread COVID-19 just as the unvaccinated. There are even schools of thought of certain experts that believe that the vaccinated individuals spread the infection more than the unvaccinated. We stand resolute to ensure that our desire to make the ordinary Ghanaian aware of the truth and the nuances of the happenings in our world today would help us collectively arrive at the best possible avenues for dealing with this pandemic and the attendant situations surrounding it. Thank you.
Thank you very much, Doc. Thank you very much. So, I don't know what to say in addition to what Doc just said. Listen to him and getting some figures and facts from him. I don't know what to add more to what he just said. Now, we've listened to a doctor. Now, let's take the second presentation from a scientist in the person of Mr. Senanu, Edem Senanu.
Good afternoon, citizens of Ghana, brothers and sisters. It's a privilege to be able to talk on this subject matter this afternoon. I don't know whether, Tim, is there any way you can... Oh, okay. So I was trying to do some slides. I don't know whether they will connect with my presentation as well as I wanted, because I've done several updates to the script. Let me start out by saying that I am the... Fantastic. So I should remove my mask. Let me make a few preliminary comments that today you have a doctor, you have a scientist, you have lawyers. So we have doctors, we have scientists, we have lawyers. And beyond that, we have people who have been affected negatively going to speak to you. So let's set the context. We are not just here to be rabble-rousers. We want you to live here knowing that there is not just a scientific, a health or medical, a legal, but there are also people whose lives have been impacted in a way where we ought not to treat this lightly as a nation. And I think that that is very fundamental to why we are here today. So we are saying stop the illegal COVID-19 vaccine mandates. And I'll be speaking to that. 4 things I'll be talking about. I'll look at Ghana's current context. I'll speak to the WHO's position. I'll speak to some recommendations that WHO has made. I'll look at some more scientific data also building on what Dr. Timothy Ama has shared, and I'll have some conclusions at the end, just to help us travel this distance together. And when you leave here, hopefully, when you are speaking about this, you'll be more knowledgeable than when you came in. So, a bit about Ghana. Sorry, it's jumped. Oh, probably I was going the wrong way. Okay, I think they've picked the wrong version. It's a updated version. This is the wrong version. So maybe it's something I sent earlier. The current version is on my laptop. Okay, so the global situation of COVID-19 has changed dramatically since the first quarter of 2020 when we were all impacted. At the peak, there was a lockdown. We were stuck in our homes. You couldn't go out. From time to time, you got a few things. But come first quarter 2022, what countries are doing globally is totally different from what was happening under the lockdown. And so, for example, you have a situation in the UK where the issue of vaccine mandates has been lifted. The issue of testing has been reduced and minimized. And where for the first time, not just in the UK, but across the EU, they are considering the fact that previous COVID-19 infections provide up to about 13 months of immunity cover. And therefore, that kind of situation is even stronger than a double dose of some of the vaccines. Indeed, the data shows that you have a 71% effective coverage in comparison with the 67% when you've had 2 doses of vaccines. At this current point, many of the key countries are reviewing strategy. And one wonders why in Ghana, along with these countries who have suddenly done a U-turn. If you take the UK, they were expecting that in April 2022, they would go full stream ensuring that everybody gets vaccination. But here we are in February, there's a U-turn. Vaccine mandates have been dropped. The issue of making sure that testing is done all the time has been dropped. And now there is a recognition that natural immunity gained from previous encounters with the COVID virus should now be considered in terms of your immunity to the disease. And therefore, that should allow you to go around the country doing legitimate business without being infringed upon, being obstructed, or being compelled to take a vaccination. Question is, what is Ghana doing? Why are we still in February 2022 insisting, forcing, and compelling citizens of our nation to have to take vaccinations, where the risks involved in these medical things have not been clearly established, and when Ghanaians are very concerned about that? So I'd like to start with that and say that there is a global context that ought to reflect in the strategy that Ghana has chosen. Now, let me talk a little bit about what WHO has said so far and use that as a bit of grounding why this discussion is so important. Now, the WHO has said that efforts should be made to demonstrate that the benefit and the safety of the vaccines are clear so that there's a greater acceptability amongst the citizenry. Now, although in Ghana, the GHS, Ministry of Health, have talked about some of the benefits, there's been almost no discussion about the risks, the safety issues. If you go to the website at the moment, the GHS, MOH website, there is no reporting on the risk, on the adverse reactions that Ghanaians have experienced. And for transparency and accountability to build confidence in citizens, that ought to have been the case, as is being done in the US or being done in the UK. What examples of people's bad experiences have we captured? And are we conveying to the citizens so that they know that, okay, these are the risks, but these are the benefits. You make your personal choice. And that is an ethical issue, which we are very concerned about. That ought to have been highlighted up to now. And the government of Ghana is not doing that. Again, they say that decisions about mandatory vaccination should be supported by the best available evidence. It should be supported by the best available evidence. How are we gathering the best available evidence globally to draw the conclusions that we have on this subject matter? So, if you consider that some of the health facilities have become very ruthless in insisting that public health doctors and practitioners must get vaccinated, otherwise you lose your job, and the other public sector and private sector institutions doing that, livelihoods are being affected when best practices are not being followed as far as the WHO has made us understand on this issue. And that is a major concern. Let me also state that in general, the WHO did not support mandated vaccination. What they said was that it was important that through education, citizens should be led to have an understanding of the issues and then voluntarily accept to be vaccinated. In other words, let them make the best choice based on the information available, because that is what the ethical considerations highlight. Unfortunately, that has not been the situation here. Whether at the airport, whether in the health sector, whether in schools, all of a sudden, without the consent of parents, children are being vaccinated. It raises serious concerns. Let me just pause and add the fact that in Ghana, for a mandate to be acceptable, for it to be legal, there ought to be an executive instrument. As of today, there is no executive instrument that has been executed by the Minister of Health, therefore making legal the mandatory insistence on vaccines. And that's a challenge. That's an absolute challenge. It means that our statement that these are illegal vaccinations is underscored by the current legal regime. I don't know whether our public sector officers understand what they are doing. And it's the reason why, as a coalition, we have proceeded to court. And I'm sure the lawyers will be speaking to where we are in that court process. Now, again, the WHO stated that vaccine mandates should be exercised with very due caution, except for a situation where all other feasible options have been considered and there is no other option. When there is no other option, the question is, is there a situation that we have no other option currently? Is there a situation that we have no other option currently? That's not the case. That's not the case. So, where lies the basis and justification for an insistence on compulsory vaccination or mandated vaccinations? There's no clarity on that, and we are quite surprised. The toolkit for tackling COVID-19 is constantly growing. And there are several antibody treatments. I mean, Dr. Timothy Ama has mentioned some. I want to add a few more, just to show that the options are so many that for anyone who's a scientist or a doctor, it doesn't make sense. Honestly, I'm wondering why I went to school. Because I can't get it. So let me just mention some more of the other treatments. Why it doesn't make sense we are insisting on vaccines. So we have Zevudi from GSK, recently approved by the UK. It has been found to reduce hospital admission and deaths by nearly 80% in high-risk adults. And they will also have the easily consumed Molnupiravir and Pfizer's Paxlovid. These are oral antivirals. So you just swallow it. That's it. It's not a jab. Okay? And they have all been found and proven to have high safety and efficacy. There are other drugs that have been approved by the WHO, including baricitinib, a drug used in the treatment of rheumatoid arthritis, and sotrovimab, a monoclonal antibody. The availability of all these drugs make the decision of our government to make a vaccine situation mandatory makes it questionable. Especially when you are asking yourself, are these vaccines the only solution or the last resort? They are not. So I've just added about 5 more drugs that are available. So why do we have compulsory vaccines? Your guess is as good as mine. I think Tim has already alluded to Big Pharma and what's going on. Furthermore, recent evidence Recent evidence from the UK suggests that prior infection reduces the chance of infection and transmission to a degree similar to immunization, with benefits as much as 13 months. And this is according to the Office of National Statistics in the UK, compared with 2 vaccine doses that reduce the risk of testing positive by 67%. So you are comparing natural immunity that gives you 71% to 2 doses of vaccines that give you 67%. Which one is more effective? Natural immunity. Persons in favor of vaccine requirements have argued that it is necessary and proportionate to protect the vulnerable patients, and that is why they are doing it. However, the ability of the recent Omicron variant that evaded all the initial vaccines, so all the vaccines that we're using did not deal with it, and many of the drug companies had to go back to do work to find out, to the extent that asymptomatic health practitioners were also transferring and transmitting it. Tells you that vaccines by themselves cannot solve this problem. If you want to use vaccines in a situation where people are asymptomatic and where they are not stopping the transmission, it means that vaccines alone cannot solve this. At this point in the pandemic, given the fact that many countries are reconsidering their approach, given the fact that the target of 80% herd coverage across the globe, there is no single country, even those who have exceeded the 80%, have not yet achieved the so-called herd immunity. It means that the theory has not been supported by the evidence on the ground. I hope that makes sense. The arguments we have been told in the past that, oh, keep vaccinating. Once you exceed 80% of the population, you will certainly find that the numbers start coming down because you have achieved herd immunity, and therefore there will be a reducing number of people who are getting infected, and the whole situation will change. It's not happened. In Israel, in Ireland, in all the countries that have gone far ahead of us in doing vaccination. Rather, the countries, as Tim said, 4 of the top 5 countries where they have done more vaccination, where some of them have exceeded the 80%, they have seen spikes, surges, and more peaks. In other words, more people seem to be getting it in those countries. It means that the theory we've been talking about has not worked. It is time to reconsider the approach. According to the Ghana guidelines for emergency use of medical products, one of the reasons why emergency use approvals or authorization is given is in a situation where there is no adequate, approved, and available alternative to the products for diagnosing, preventing, or treating such serious life-threatening disease or conditions. Can I say that again? You are given emergency use approval for a vaccine. It is only done when there are no other options. Hello? So I'm even wondering why this approval was given when there are options. The condition for giving emergency use approval, and emergency use means that it should not become the default. It should be the exception to the rule. Let's get that right. What emergency use approval by our FDA means is that the use of the vaccines in Ghana should be the exception and not the rule. That's emergency use approval. And it also means that the approval itself ought to have been given only in a context where you do not have effective alternatives that can deal with the situation. After 2 years of scientists working hard to get on top of this issue, and where scientists across the globe have provided alternatives, one cannot understand why our experts and the so-called technical group meeting every 2 weeks advising government. Fortunately, our president seems to align with the citizens on this matter and say there's nothing mandatory. I mean, that tells us that at least there's hope for us. why are other ministers and directors taking a position contrary to what the overwhelming scientific evidence shows, and contrary to what the laid down legal framework allows them to do? It doesn't make sense. Why are they holding on to old knowledge and not making any effort to stay abreast with current options? For example, I mentioned 5 already. Let me mention some more. Locally, we have dexamethasone and remdesivir, which have been used effectively to treat people with COVID-19. I've refused to mention the ivermectin, hydrochloroquine, erythromycin, because people want to argue against them. So let me mention 2 more. I've just said there are others. And this information, by the way, some of these are even on the applicable use at Kolebu. They are being used for human beings. Now, why isn't that education at the forefront of what our public health officers are saying? Why are we only going vaccine? Why are they not telling you there are drugs you can take? It is for this reason that the WHO makes it very clear in its policy brief that individual liberties should not be challenged for longer than necessary, which is what they are doing to us. Our liberties and rights are being challenged. Policymakers are required by WHO standards to re-evaluate the situation of any form of mandate regularly, so that as soon as necessary, if a mandate becomes unnecessary, you remove it. What review is being done within the global context? Especially when we know that vaccines by themselves are not the panacea for the situation we find ourselves in. Let me move on to add the fact that people have genuine concerns, and you'll be hearing from some of the people who've been impacted negatively in a few minutes. Spoken to this already, so I'll move on to the next slide. People have genuine concerns about what happens to them when you inject them with these things. Is it right that if I have a concern, you should listen to my concern? Isn't it right? Is it right that if I feel like I don't want to take this for my own good, it should be taken on board? Is it right, especially when our national laws tell you that if I say I want you to test my natural immunization, my natural immunity, you should provide the facilities for me to be able to show that I'm naturally immunized? And when the state has not done that, why should I be compelled to take your option when I have an option? So, if vaccines who have been have been labeled as experimental, which have been labeled as emergency use, have suddenly become the norm around the globe, should all of us just follow them? It is a fact, and anyone can check, that at the moment there are over 1,000 scientific studies reporting on the adverse effects. And I've listed some of them there. Many of them, Tim mentioned some. Let me mention some more, just so that you know the risk you expose yourself to and the reason why Ghanaians and many citizens across the globe are concerned. Paralysis, menstrual abnormalities, blood clots, myocarditis, pericarditis. These one are heart things. Heart inflammation. We should have shown some of the video clips with the sports people who are collapsing on football parks, basketball fields, etc. Cardiomyopathy, vaccine-induced thrombotic cytopenia, autoimmunity resulting in death, cerebral hemorrhage, thromboembolism, and several unexplained deaths following vaccination. Isn't it interesting that Ghanaians are not being told anything about these unfortunate side effects? Is it also not curious that anybody who raises issues is immediately being told, keep quiet? Oh, what have I done? To come back. Oh, why does it keep doing that to me? It is in this context that we believe strongly that not only are the vaccine mandates illegal, and we are asking the president and his ministers to stop the promotion of these illegal vaccine mandates. We also believe that it is time that the technical team and all the advisors reevaluate the data. I side with Tim. The initial, and it's interesting. The coalition is from different splinter groups that had raised concerns from last year. And it's only in the last week or so that we got together. So I didn't know what he would talk about today. And he's taking some of the issues that I would have raised. But truly, and I want to highlight this, that as I listened to the doctors talking about the vaccines prevent more serious impact or adverse impact, the data they provided, straight in my mind, I was like, where was the big end? The population size. You know, in statistics, you need to be cautious how you do your percentages. And they kept talking about their facilities without realizing that the total population of Ghana ought to have been the base for the calculations. And there was no way the percentages were calling would be possible if they were considering the fact that 80 to 90% of Ghanaians had not been vaccinated at the time they were doing their calculations. So the data being provided at the moment by our health leaders, the way they have calculated the percentage is skewed. Ask them to go back and look at the statistics well, perhaps get some professors to help them. It is in this context, therefore, we appeal to our president, His Excellency Nana-Addo Dankwa Akufo-Addo, to call his ministers and appointees to order, to do what is in the best interest of all citizens, not some citizens, not a majority of citizens, in the best interest of every single citizen of Ghana. That is the mandate we have given him and this government, because every life counts. Vaccinations may continue to the extent that citizens understand the risks they are exposed to. However, compulsory vaccinations should stop, and they should stop now. We call on the Minister of Health and the Director General of the Ghana Health Service, together with the Minister of Education and Director General of the Ghana Education Service, and all the other public institutions, parliaments, and what have you, I think there are about 13 of them, to withdraw the various directives mandating vaccination. We urge the government of Ghana and its technical team to consider and promote all the safer alternative options that are available. And not just that, they should regularly highlight these safer options, as well as provide information on all the adverse reactions that citizens have experienced in Ghana as a result of vaccinations. We, as a country, should not force. We should not compel. We should not insist. We should not, for whatever reason, drag citizens in public institutions and say, you will lose your job if you do not get vaccinated. This infringes on citizens' rights, our rights, to make personal informed medical choices as we deem fit. It will affect Ghanaians in the long run, and we believe that this does not promote the democracy and the democratic credentials of this nation. We thank you for your attention. God bless you, and God bless our homeland, Ghana.
Thank you very much. Thank you very much. Now we've listened to the first and second speakers. We are now going to listen to the third speaker, who is a lawyer in the person of Richard Nunekbeku. Sorry if I pronounce it wrong.
Good afternoon to everyone. I have been very concerned listening to the doctor and the scientists giving us the science and data about COVID-19 and the vaccine rollout in Ghana. But if you are here or listening to me and you are not concerned, about the science and the data, there is one thing I want you to be concerned about, which is the illegality of the mandate that have been rolled out. We live in a country guided by the Constitution, which is the supreme law of this state. And that Constitution mandates certain performances by public officers particularly. So the president is not above the law. The minister is not above the law. No state institution, likewise, is above the law. So we will expect that whatever they do, be it a directive, be it a mandate, must be in compliance with the laws and regulation of this country. Because that is the only reason for which we exist as a country. And for us, as a Coalition for Public Health and Justice, our concerns are not only medical. Our concerns are also legal. And those are some of the issues I'll be speaking to this afternoon. Now, first and foremost, we will appreciate that we live in a country governed by the 1992 Constitution. And we always say that as a country, we believe in the rule of law. And the basic meaning of rule of law is that you act in accordance with a certain law. So everything you do, you must point out to which law gives you the power to do so. And our concern basically is that the 1992 Constitution has guaranteed for all of us here and those listening to us from their various locations certain rights and freedoms. One of the basic rights and freedom guaranteed by the Constitution is found in Article 21, 1G, which is the freedom to the right to the freedom of movement. And if you look at the Constitution clearly, that right includes the right to move around freely within Ghana. So it implies that no one can restrict that right except within the context provided for by the Constitution. So therefore, where we have mandates that are requiring citizens and persons, be it employees or other stakeholders, engaging public or procuring the services of public institution to show proof of COVID-19 vaccine, otherwise they will not access the facilities, we think that such mandates are restrictive in their strict sense. You cannot run away from the fact. So if you tell me that if I do not show a COVID-19 vaccine card, I cannot come to school, what are you trying to tell me? You are telling me that I do not have a right to education, indirectly. If you are telling me that without a vaccine card, I cannot access parliament to meet my members of parliament that I have queued and voted for to represent me in parliament, you are telling me that I do not have a right to move freely. So for us, we are concerned about that. And we also recognize the fact that beyond these rights being provided for in the Constitution also enjoins persons in authority, including the legislature, the executive, and the judiciary, to at all times uphold the respect for these rights. So no one have an excuse not to respect the rights that have been guaranteed by the Constitution. However, these rights we know are not absolute. Why do we say these rights are not absolute? Because within the constitutional framework, you have provisions that provides for circumstances under which certain restrictions or limitations can be placed on the enjoyment of this right. So for instance, if you go to that Article 21.4, a list of circumstances have been provided. And we all know that when COVID-19 broke out, Parliament of Ghana passed the Imposition of Restrictions Act, which the president has religiously in the past used to impose certain restrictions on our movement. So the lockdowns that were imposed in the past were on the basis of the exercise of president's power under the Impositions of Restrictions Act. However, there is a basic provision under that law, which mandates the president only that if the president so wishes to restrict the freedom enjoined by the Constitution, the president is supposed to issue an executive instrument in that respect. And as we stand here today, no executive instrument have been issued by the president in that respect. And the president, in his response to the concerned doctors, have also indicated clearly that he has not mandated any COVID-19 vaccine in Ghana. So the question we ask is, where do the persons and institutions that are mandating compulsory COVID-19 evidence getting their power from? Where are they getting it from? That is what should be of concern to all of us as citizens. Whether you believe in the science or you believe in the data, the lawlessness that is being paraded around today should be of concern to you. And that is why, as members of the Coalition for Public Health and Justice, we think that there is an opportunity for us to go to court for these institutions and persons to come and show us where they are getting their powers from. Because we do not live in a country without laws. We live in a country with rules and regulations, and we expect anyone who acts to act in accordance with those rules. Now, you remember the speakers before me were of the view that the minister can mandate compulsory vaccination. That is true. The Public Health Act gives the minister the power to mandate compulsory vaccination. But the minister can only do so when the minister passes or issues what we call the executive instrument. Now, there is something curious under that power. If you read the provisions of Section 22 of the Public Health Act at 851, you will come to the realization that certain persons have been exempted, even if the minister issues an executive instrument mandating COVID-19 or any vaccination which should be compulsory. Persons who have natural immunity. And the speakers who spoke on science and the data have also shown you that the effectiveness of natural immunity is even higher than the COVID-19 vaccines that we've seen today. Persons who, for health reasons, cannot take the vaccine or any mandated any COVID-19 compulsory vaccination in this country. So we are of the view that that is unreasonable, that is unlawful. There is no legal justification for any of the directives being issued, whether it's even from the Speaker of Parliament. That is even worse, because the Speaker has no such powers to mandate such vaccination. And if you look carefully at the regulatory regime for medicinal products in Ghana, we all know that the Food and Drugs Authority is the body mandated to regulate the licensing and approval of medicines in this country. And if you look at the guidelines that was issued by the Food and Drugs Authority, under which these COVID vaccines are being rolled out in Ghana, which is the Emergency Use Authorization Guideline, you'll be shocked to note that that guideline clearly provides that where a medicine has been given an emergency use authorization, it implies two things, critical two things. One is that the consequences or the health risk associated with that medicine is unknown. So what we are taking today in Ghana as COVID vaccines have unknown health risk. Two, when such authorization is given, persons who are supposed to take those vaccines are supposed to be given enough information to be able to make personal decisions. Very important. Personal decisions, whether or not, on the basis of the information they have, to take the vaccines or not. So by the FDA guideline, you cannot compel anybody to take the current vaccines we have in Ghana. By the mandates that have been issued, you are compulsorily forced to go and take the vaccine. So are we respecting our own guidelines? We are not. The guidelines that we have in place for the interest of all of us, for public health and safety, to ensure that medicine and medical products that are administered in this country follow a certain protocol to ensure that we don't put the population at risk, is being abused. Persons are now being forced to take the vaccine without the options they have under the FDA guidelines. And we think that that must stop. That is without legal basis. That disregard for public policy and laws is becoming too much. And we will ensure by our court processes that all these institutions are ordered by the court to stop this mandate. Now, interestingly, the doctors and the doctor and the scientists have spoken extensively about the safety and the efficacy of the vaccine. There is something I want to add further. If you look at the contraindication report that is issued by the CDC of the US, you realize that these vaccines have serious health implications for those who have taken it or those who are being forced to take it. It is not one that we should encourage our citizens to take without the opportunity given them to exercise their personal decisions. Our policy or our agenda is not to discourage the taking of the vaccines. Our agenda and our goal is simple. We have individual rights. Those rights are guaranteed. Let us exercise those rights within the framework of law as provided for in Ghana. No one should be compelled, either by a directive or by a policy mandate, to take the vaccine, given the generality of the laws that exist, that we have said that the institutions and persons that are mandating these compulsory vaccinations do not have any power. Do not have any power. It's only the president and the minister. And even that, there are contexts within which they can exercise those powers. So you ask yourself, where is the vice chancellor, for instance, or the registrar of UCC getting that power from? Where is the director general of the Ghana Broadcasting Corporation that have said that if employees do not show cards of COVID-19, they can't come to work? Where does he get that power from? What are we creating? Are we creating institutions governed by rules of men, or we are going to create institutions governed by the rules that we've all agreed to govern us? So those are the legal concerns that we have. And we think that it is incumbent on all of us as media men and citizens to join this campaign. Because if, like I said, the science doesn't matter to you, the freedoms we have should matter to you. This is a country that is governed by laws. The 1992 Constitution remains supreme. And then we expect that everyone who acts must act in strict accordance with those provisions. Thank you very much.
Thank you very much, Council. So we go straight to our Q&A session. But before that, just want to do this quick exercise here. So those of us who over the month, let me say, start questioning about our existence, the coalition existence, we have a certificate here which shows that we are a registered entity. Thank you very much. So those who, for the camera's sake, let me. So we now go to our Q&A session. Please, if you have any question to ask any of our presenters, please raise up your hand. We have extra microphone here. I can get it to you. We need 4 sets of questions, or 3 at least. If any. If we don't have any, we proceed. Okay, TV3.
Thank you very much.
Please, you mention your name and where you represent.
My name is Samani, Emmanuel Samani. I work with TV3. So my question goes to the scientists. You made mention of some alternatives to the vaccine. You made mention of dexamethasone as well as some other medications in the treatment of COVID-19. I just want to point out that from what you said, I also looked up the WHO website, and the WHO website did indicate that these medications are not to be used for COVID-19, but you stated in your presentation that the WHO has actually licensed these medications for the treatment of COVID-19. Secondly, with regards to the efficacy levels, for my research, Pfizer has 95% efficacy, which runs to at least 6 months. And I also want to be clear, if you are against the vaccine mandate or the vaccine itself. And from Dr. Timothy, his presentation, he also made some remarks. I just wanted to find out from him if these remarks are from peer-reviewed scientific journals, so we can actually also do our own research and draw our own conclusions, because some of the statements made, I tend to disagree. And finally, I'm glad that he did mention Vias in his presentation. I'd like to ask him if he knows that Vias is an open site, if you will, that anyone can go and post on there, like Facebook, like a wall on Facebook. So how are you confirming these reports of vaccine serious side effects? Thank you.
Thank you. Before they or you want to respond to? Okay.
All right. So I think you prompt me if I don't remember some of them. So
Sure.
the first one you had was about the dexamethasone and remdesivir, and the point. Oh no, I heard you. Let me speak to it. Yeah. Now the point I made. Please pick a copy of the full text from Tim. Please give me a copy of the full text. Now, the point I made there was that locally, dexamethasone and remdesivir are being used for the treatment. It is the same as the fact that ivermectin, hydrochloroquine, erythromycin are being used. And yet, in other jurisdictions, people are insisting that these are not efficacious. Hi, are you with me?
I'm listening.
So, if you pick a copy, you'll find it that I've said locally, dexamethasone.
Basically what you're saying is that this is a local treatment plan, not based off an international standard. This is a treatment plan that you or your group are actually using.
No. It's not a,
I just want to get the clarification.
No, yeah, and I've stated it. And the clarification is that locally these drugs are being used.
Yeah, but it says
Sorry.
It says here for a fact that I think we can all check. It says hydrochloroquine or Dexy
let me make my point.
Okay.
Part of what we've been saying is that the position taken by external people should not always be what we should be looking at. What local investigation and research are we doing into what has worked here? I get in the point.
Yeah,
because our doctors and practitioners, especially in a context where we have done very well, Ghana has done very well, go and engage the medical and health practitioners. And the drugs that in the US and elsewhere they say don't use are the same drugs that have been used here. Tim said the same thing, I'm saying the same thing. And they found them to be very effective. It doesn't make sense. So we are saying, let's do some more research. Let's establish what has worked locally. Let's not just pick up what others have said and say, don't do this, don't do that. Especially where their situations have proven worse off than ours. So what are we doing right? I hope I'm making my point. Okay. I've always wondered, across Africa, we've done much better. What is it that we have done differently? When they wouldn't give us the vaccines, when they could not arrange for us to receive them, our local doctors came up with solutions, and here we are. And those who have pursued, have championed, and run after more and more vaccinations, those countries especially seem to have more surges and more spikes. Something doesn't fit together. Something is not connecting. And that's the point.
Okay.
Now, what's the next point? What was the next question?
So I don't want it to be like a debate. I just want to,
I've answered that. So I'm saying more local research.
Yeah.
Next.
So more local research. So is it a controlled study? So that when you're done treating, say, 60 number of persons with a particular drug, then we know for a fact that whoever is having COVID-19 symptoms, if you treat them with so and so, we know for sure.
Absolutely. Okay. We need something with controls, an experimental design that takes all these drugs. And we are worried that we may have a situation where Big Pharma is taking advantage and exploiting citizens across the globe. That we are really concerned about that. I'll just be blunt about it. That we are taking advantage of citizens across the globe and pushing an agenda when the doctors who are treating us, I was treated with some of these drugs. I was treated. My family has been. I'm sure if you could do that research right now, talking about erythromycin, ivermectin, hydrochloric, right in this room. If you like, try that question and you will see the result. Next question.
So, from the medical point of view, I know those drugs, as you listed, WHO has commented on it. Yeah. But what is really happening on the grounds is that when we have COVID pneumonia cases, in fact, to reduce the level of inflammation and all that, across board, all doctors use dexamethasone. You may challenge it, but that is what is happening on the grounds. Anybody who is experiencing COVID will tell you one way or the other, hydroxychloroquine has been thrown in, or azithromycin, and they have recovered fully. So just to add to what he's saying, now your question on whether we are fighting the vaccine or the vaccine mandate, we need to make it clear. When you are mandating something which is good, you just get a small fraction talking about it or raising questions. You can mandate something which you think, or per the data showing, 1, it is necessary, 2, it is effective, and 3, it is safety. But if you cannot prove to your citizens that 1, your vaccine is not necessary, 2, you cannot prove to us, because when we wrote back to him, we're expecting quite a long list of research, which they called our research that we proved, whether it's been peer reviewed, we quoted from sites like the way you two. Okay, I have quoted mine, but what about that? What about theirs? Where are their research findings? The only thing they could prove to us was the data they collected overnight from GIDC. And these are things they know it's true. I don't think as citizens we should go into the muddy waters. If a vaccine is good, even let's consider the polio vaccine. It is a good vaccine, but why are we not mandating it? There are several children who have not received polio immunization, but do we mandate it in schools? Do we mandate it? No, these are things we don't. There are several people who are traveling and they've not even received their yellow fever vaccine and they are able to go to other countries. So this is what we are saying. Is this necessary for us as a country? Is it even effective and is it even safe? You may talk about VAS just being like Facebook, but I tell you, with VAS, at least they are reporting just 1% of all that is happening. And these are people who are freely talking their mind and their personal experiences from their consultation with their doctors in their consulting room. I have several of such clients I deal with like that, where they come, you do cardiac enzymes, and the enzymes have shot up. You do ECG, and you are seeing your ECG changes. You do D-dimers, and there are blood clots all over. And some even reporting with DVT. We call the centers, nobody minds them. But we... So, please.
Go on. I mean, this is why we are here. So,
yes.
To get
So
the clarity
I think you should understand why we are fighting the mandate. There's something fundamental which is wrong. You have not been able to prove to your nation whether this is necessary. And you can only prove it is necessary when you look at the data which is staring right at your face. And Ghana has been doing well, proud to the vaccines coming in. Then we look at the efficacy of the vaccine. You've not been able to prove to us. Where are the research findings? They should bring it. Just like the way we have brought ours and we are talking about it. So they should also bring it out. They should come and tell us, these are our research findings. That shows that this vaccine is efficacious. And not something which has been cooked over the night. No. We are scientists and we are doctors. We need to stand for what we have been called to do, to serve the people of Ghana, and that is exactly what we have to do. Thank you very much.
Okay.
Thank you very much, Doc.
Yeah. Such a number of them.
Oh, it's a mandate. Okay, yes. The second question was whether it's against the vaccination mandate. It's against the mandate.
Against the mandate. So
vaccinations can continue. Okay. And vaccinations have proven to be very good for all of us in the past. We grew up being vaccinated. But this mandate, because of the peculiarity of the vaccines being, there's a problem because the risk suggests that I should be given the opportunity to decide, will I take it or not? So that's why we are saying, continue the vaccinations. We don't have a problem. But allow citizens to have the choice.
Okay.
And don't allow, let me tell you, look, our first press conference was on the 14th of December. What happened? Medical doctors and directors who are members of our group and those even outside were like, isn't anyone going to talk for us? We were given a deadline of 15th December. You know, so at that time last year, 15th December 2021, some medical facilities had given their doctors and whatnot a deadline that if you've not done it, you can't come to work or something like that. So it was the doctors at the front line, public health officers who were concerned. And so we called it on the 14th to try and raise our letter. Please, government, people are not happy. Some of us were not being, I could still have gone to work. But for the sake of especially medical health practitioners who are like, we've been given 15. What are you people saying? How are you helping us? So please, it's a choice. Allow our citizens not to feel like it's a crime to have offered myself to serve the public. That's not right.
Thank you for the clarification. And finally, I also wanted to point out that no, it's not a question. It's
before that, I beg you. There's one of our doctors who want to respond to your question.
On
we
which
just want
one?
On the vaccines.
The
So
VAS,
please,
okay.
Hold on. Hello, Doc.
Yeah, hello.
Yeah, please continue.
Oh, okay. Yes, good afternoon. I wanted to address the concern with the virus. Now, there is this, yes, virus does not prove causation. In other words, the fact that somebody experienced an adverse effect after taking a vaccine doesn't mean the vaccine caused it. That's fair enough. But in everything, you need to compare like variables with like variables. Using the same virus, you can compare the adverse effects to these vaccines with other vaccines and with other drugs. And you realize that with the COVID-19 vaccine, the numbers are through the roof. That's number one. Number two, most of these people, they report these adverse effects within less than 2 weeks of going for the shot. Number three, entering data into virus is not as simple as Facebook. If I take my Facebook and I just type thinking about ABC and I just press post, it comes. Virus is not like that. Virus is a complicated system where even doctors get frustrated. And that is one reason why a number of doctors in the US don't even report to virus, because the system is frustrated. It doesn't make sense for somebody to frustrate himself just to fake an adverse event report on virus, which will take at least 30 minutes or more to do. The stress is not worth it. Even if there are people doing this, how many people are doing this out of the over 20,000 reported deaths? How many people are sitting down and saying, let me just go and fake a report on virus? It is not practical. Not to say that every single report on virus is credible, but you have to consider the context. It is not the best system, but it is the best we have so far. And even research from Harvard will show you that virus only accounts for up to about 1% of the adverse events. You understand? So yes, even though virus is an open system, it is not like Facebook per se, or Twitter or Instagram, where I just put something there and press push. There are certain things you have to go through. And for the last point, a number of the various reports are actually vetted by the appropriate authority. Usually they don't get through all in time, but most of them are vetted. Those that are proved not to be, not to be relevant tend to be taken down. There are some duplicate reports and all that. All those things are taken. So yes, virus may not be the best. Number one, it may not prove causation, but it is not something you should dismiss. In fact, most experts with adverse events as relating to immunization will say that this is one of the best systems worldwide we have.
Okay, thank you very much, Doc. Okay, so that's it, TV3.
Yeah.
Please, let's pass the...
And I just wanted to also add on that after the rollout of the national vaccination COVID campaign, it is said that should anyone have any side effect, they can report to their nearest district for free treatment of any side effects that comes out as a result of that. Yeah.
Thank you. I think that's a good point. I think Tim pointed out that people have been calling. Sometimes there's an emergency. The doctors themselves are calling the technical team to try and get feedback, and they're not getting the support. So it's on paper, but the system to make sure it works for the citizens does not appear to be in place. So let me highlight that. It's on paper, and it's good they are saying it. But the system, those who have tested the system to try and get support, they are not getting the help they need. So if we really want it to work, let's do much more to make sure that that system is reporting the adverse effects and is providing support to individuals. By the way, I don't think we've mentioned the fact that we hear there's some money for people who get affected and we don't know what's happening to the money. Is it true? It's not true. Okay. All right. Please, who's next?
Okay.
Metro TV.
Hello. Okay, so my name is Elvis Ando, Metro TV. My question is, you've tried all attempts. You've organized press conference. You've petitioned the president and also filed a suit against this whole thing. What is the next line of action for you?
We just mentioned that in our, I think, Doc mentioned that we, and then the lawyer also said that we will be going to court.
I think I missed that part.
Okay,
so
sorry
if it
for
can
coming
be
late.
recorded.
Okay, so I think this time, if no question, we call on the national communication.
Sorry, my question hasn't been answered. So I want...
Come again.
Yes, you've sued, right? You filed a suit against the government for the process. and you also organize press conferences, and also you have petitioned government. What is your next line of action? So you say you are now going to court. That is it, right? Okay, thank you.
And the answer to that question is that we are filing a suit in court. We believe in justice as well, and we are law-abiding citizens. We strongly believe that the court system is an avenue for us to get this stopped.
Yes.
So we'll pursue that avenue, believing that our arguments are sound and they are what the law prescribes. So the judges will agree with us and get this illegal mandate stopped.
Okay, I'm Calvin from GH1 TV. I just want to know if the coalition has the intent of researching into local medicines that could be given to the government or suggested to be used aside the vaccine that we are taking now.
It's a nice idea. Please, so we'll use this platform to ask well-abled Ghanaians, individuals and corporate entities. A few months ago, I went to Noguchi asking why we're not doing our local research. And they said, look, we are more than eager. At the time, they already had about 30 Ghanaians with options, remedies that have been submitted. They needed funding. And I asked how much. I think at the time they were talking about if they had about 200 million Ghana cedis, they'll be able to do the research. And you know, when you find even one, the money that it will make for this country will be so much more. So let me use this platform, as it were, to make a campaign for our local indigenous herbalists and whatnot. And not just them, but also Noguchi. Noguchi has one of the only, I think, P4, there are 2 P4 labs in the whole of Africa. They have the capacity to do this research and to get out results that will make this country earn resources. And so let's raise funding for our own people. What is from Ghana is also good. What is from Africa is also good. Thank you for that proposal.
Thank you very much. Okay.
Yes, good afternoon. Good afternoon, everyone. Good afternoon, everyone. Okay, greetings. I would just like to say I congratulate the Coalition for Public Health and Justice for bringing this press conference. It is very important that the media in particular pay keen attention to what is happening in the world and in Ghana in particular. We often find a situation where the media is not proactive in social and political issues to the extent at which it is necessary. I am pleased to see that there are so many media outfits are here today. So congratulate yourselves. Secondly, what I would like to find out is that if the government is searching around the world for solutions and is going to these biotech companies and the multinational corporations and these big countries for solutions and support, yet still we have a strong relationship with Cuba, a very strong relationship with Cuba. And Cuba has offered Ghana technological transfer of their vaccines, which they have produced 3 vaccines. And I'm sure the efficacy of Cuba's vaccines is way above Moderna, Pfizer, and all of those, right? So I'm asking the question, asking the government the question, why have they turned their backs on Cuba? And Cuba is one of the #1 when it comes to health system in the world. Finally, I would like to say that I would like to see that the trade unions in Ghana, NUGS, the Christian Council, the Muslim Mission, all the medical institutions, traditional council, and civil society in general stand behind this advocacy. Give thanks.
Thank you very much. I think that there's a last person who wants to. Yeah, Reverend.
Good afternoon. I think my question goes to the media. I think sure. First, the last time that we had our last press conference, a lot of media houses came to cover the program, but we didn't see any show. So we were wondering why. What happened? They didn't show it on television.
Okay.
Sure.
So what he wants to say is that the press...
hold on. And secondly, we know what is happening in Ghana. A lot of people are complaining about the side effect that they got after they got the jab. But they are not talking about it, and we are wondering why the media house know all these things, but they are not talking about it on air. So that's my question. Thank you very much.
Okay, thank you. Thank you. So now we call upon the victims, if any, and no, please, we don't have data. Please, the victims who are here, direct what we are doing here. I beg you, the media, I beg you. You are not supposed to direct us as to what we want to do here. Please.
Hello, please ignore that. Please, the victims have a concern. I'm just trying to give a bit of a background. As you can imagine, this is a very sensitive issue. Hello? All right. We have some people who have traveled to come and share, but they are very concerned because it's a very emotional issue for them. So please, let's accord them as much sensitivity as we can. Is that okay? Can you stand? She says she'll try. Okay. She says she'll try. Please.
But I friend me doctors. Me dear no. Na menyam. But na minim minyam hui. In the first one nearby and na me di kan ko obi. In the me wo wie ye no be 2 weeks. Na ase me ho eye me basa. Ti me ko hospital no na. Doctor ka say menyam. Na omuma me ko ye lab na me twa scan. Na omuma me nru. Na omu say me nko enkonom. Ti me ko ye no ase still na me ho nyem yie ba me nim say ma wo be 3 ntie bia nyisen na ama me ho na ya me sa. Ti me san ko hospital ho na doctor na ka che me say o change enre na mame. Nti me nko 2 weeks men samra. 2 weeks no anso na ise mo fie na ise me yam no eye me style bi na ise makuma no e contentem. Ti ne mfifra start me. Nti me tena se na ma sorry na ma no msuo ase mo yam basa na me hu de menya me ho. By manka minim say nyinsen na. Nti ade chia na mko hospital na doctor no e ma medro bi say 2 weeks men samra. Ti 2 weeks no me kwa no bi say me say nyinsen no e free ho. E na me say there bi say me ba wan kan che me say nyinsen no problem wo ho no say ene kwetwa scan ti me kwetwa scan no me san ba no bi say me say me wo mani bi wo ho na me say me obi wo ho. E na say me obi wo ho de a ene we no de asai enti ma yenye medi ansi na yenyi to ye na me ka se ada bi se me ba last year no wan kan je me se problem wo ho o ma me kutwa bibia na ye de na afide o kan se na o se onyema esesa akura no da nsuo bim na odane dane ho ba me de no nsuo ni nyina wi afiri ho enti we bi na kwetale ma wode no ho enti se ye nyi a menya problem enti me nkofa sikamra enti waka za no na me frɛ me kun na me kun ka se ne me nko different hospital bia na oboa ade no betima yi ti me ko ba bi foforo no na omo so ko twa scan na me se still ade no emsuo bia ni ho enti etale ma wo de no ti Jesus so DNC na na ye enti DNC no ye no Monday enti doctor no catch me say on me pane obeye because just a yinam see you enti ye start ye o twe ade na san ko enti wo ye bia fe the doctor no say why DNC ya ba se me de no edi o twe ade na enye yie because bibia free ho amana ye tintan ti oyi a emma nti wa try bia na wo hwa wo yi bi na bi sa kai na mma medro bi se me nkonom na de aka ni nyina beba ti me ko ye no Friday so na se me yefro no iye de bi nti msa ka na doctor say this is na ye me biem nti that time no bi sa me se ma wo pane ni bi na mso medical ko wo bi na na minim se menyam wa anka hwe no se ne this is na ye me another DNC and omo ye me foforo ena omo yi ade ni nyina efim sana me den.
Okay, it's a very sad one. Thank you very much.
Enti ba ko so esan ka ho no na ye mi kunu ono ka che me se ne ho ya na basa ena me de ne ko 37 ti e ko 37 no na omo ye no labs bebre omo hu ade kura ha no nti ye ko ye we ni akoye we ye ko ye we ni akoye we 2 days ena no free ti o free no na wa wo bi enso omo anje de hu ade kura pa nti me kwaje yi no death certificate no mo say covid na wanya enti na wawu enti me kunu ni wuye no na nipa ono so be she me kunu na iwo adwuma nim no na onwo bi ti ene na ye ni ye bibia na ye de ne she me kunu na iwo adwuma mu ho enti Monday no ko wo pane ni bi ti Monday na me ne kasai no say owo pane ni wi ye ne ho ye no basa nti wako hospital but almost onye pala nti wa be fie ti ade chi Tuesday ena okọ adwumam ti adwumam ho no na oye ko na ase ne phone no etofom ti no munim se bia odi agro nti omgohwe no na isa ase okọ off no mde ne ko hospital tomde ne ko hospital no na omde ko emergency ti ade ne ko emergency won na jese won so afrim enti ebisa abusuafo no bae na omse ompese omuhu ade kura eku omunipa no because na onyale enti doctor no say omde ne bae no na ni ntini use eyi na moja ne fem no asisi enti na ne ho eyi no moja ni nyina abobo apo intimi enye anya adwuma sa time no enu nti na ofiri mu anu se de won.
Okay, that's it. Okay, thank you very much, my colleagues from the media, for joining us to have this successful engagement. And to our key speakers too, we say thank you very much for showing up. All the call that the media have been made, and where are the doctors? I think this time around we have the doctors, and they've been able to deliver to us to go and say. So we will have copies of the scripts, both through e-line. I'll be sharing those through electronically, and then those that have the paper copy too. We'll be sharing those ones to you. There'll be someone to attend to the media. So please, media, when you're done packing your equipment, please stay with us as our dignitaries leave us. Thank you very much.